We have Commissioner Department reports. Sonny, and then Dan.
Just want to talk a little bit. We mentioned a couple times earlier about the Jail Ad Hoc Committee. As you may recall, when the committee was formed, Commissioner Mayer, myself, and Captain Ritter were appointed. We as a group have had some discussions about, who else should be a part of this ad hoc committee. I know Carol had mentioned former Judge Phil Rogers. At least in my mind, the goal of this is try not to get it too large. We've done the 21-member Blue Ribbon Committee for 15 months. I don't want to go through that again necessarily. I have reached out to former Judge Rogers and have talked to him. He has expressed an interest in helping in any way he can, whether it be as a formal member of the committee or how we wanted to do that. He's willing to help. I had a little discussion at Community Corrections meeting last night with Sri Shively, our Community Corrections Director. I said, maybe what I also would, if I was looking to add something, another dynamics, if you will, to this committee, maybe a defense attorney or a former inmate from the jail. And she was going to put together a list of possible recommendations for that. As we talk about the jail, we talk about the conditions, we talk about mental health. It kind of helps if we have that perspective. I personally haven't spent much time in there, and really don't desire to spend a great deal of time in there, unfortunately. But we need to make sure that we're looking at various perspectives of the conditions in the jail. I reported to you at our last meeting, I believe, that Captain Ritter and I have worked on a boilerplate draft, if you will, for the jail consultant. We've taken out some stuff, he's taken out some stuff, I've taken out some stuff. I think we have that about ready. With your approval, I'm going to meet with Chris Forsythe to review that before we bring it to you for a final adoption of, this is what we're looking for. Basically what we're trying to do is define the scope of work that we want to have done. I don't believe, at least in my mind, I don't believe it's our intention to have to go through that whole process over again. Yes, we need a new needs assessment to determine whether 300 beds is the right number today or whether it's 320. But we need a new needs assessment, but we don't have to go through the whole process. We simply know that we don't have an adequate jail. We need to deal with that. I met with Captain Ritter and the sheriff last week about the community mental health things to try to define what we're asking those people to bring to the presentation for our meeting on the 15th. We have included in that a goal, if you will, that every person booked in the Grand Traverse County Jail will have a mental health assessment within 24 hours of being booked. Now, some of those are going to be a 5-minute thing, some of them are going to be a lot more. But whether that person is a CMH patient or not, we believe that everyone needs to have some mental health assessment when they're booked into the jail and within a, now, if they booked in Friday night, it may not happen till Monday morning, but the goal that we're outlining to these people is that a mental health assessment will be done within 24 hours. We talked about, the idea we may need to add social workers in the jail. Many of these people just simply need someone to talk to, and we will figure out how the logistics of that works, but we may have to add something to that. Now, whether that is added as a separate contract, one of the things is the idea that we already have a contract, as everyone knows, with CCS to provide medical and mental health services in the jail. They in turn have a contract with Dr. Conlon to provide services in our jail. I had some conversation with Dr. Conlon about expanding her services, which she seems to be interested in. Because she is currently under contract with CCS, possibly it's cleaner for Grand Traverse County to expand our contract with CCS and let her contract be expanded with them. rather than have a separate contract with this one and a separate contract with that, because then if something goes wrong, you always get this finger pointing this way. You know, if we can figure out a way that we expand our contract with CCS and they expand the amount of mental health services that are available in the jail, I think that's a win-win for us. But all of those items are going to come with some sort of a cost, and I don't have any idea what that number is going to be. But the goals that we're putting out there as part of this product, or as part of this package, is that every prisoner will have a mental health assessment, and there will be expanded interaction with every prisoner in the jail, and medications will be taken care of, and there will be follow-up for medications. I think that's one of the pieces that we're kind of dropping in right now, is whether or not the medications are being administered, if they're being administered properly, and whether we're getting the appropriate follow-up. And the medical contract is probably the place to deal with that. We'll see what comes back. You know, my goal, for what it's worth, and nobody's going to be surprised in the room by that, my goal is that CMH be responsible to do the assessments.
Yep.
That should be part of that $682,000 we pay them a year. You know, I'm willing to expand medical services, but I believe the assessments are their responsibility.
Okay.
And you know, we will keep you posted. You know, I'm sure as everyone knows, I've been kind of in and out the last couple of weeks, but I think we're getting now to where I know that Todd has met with all 3 providers, and I have spoken with Dr. Conlon. She happened to come to my office and talk to me one day, so I think we're on the right move, and I'm very excited to see what we hear on the 15th.
Sonny, is with community mental health, is Wexford County, they're on that same, they're taken care of by?
Yes.
So has anybody reached out to Wexford County, Wheelock County?
All of the counties are having the same issue with the mental health issues in their jail.
They're all having the reduced response, reduced hours.
Yes. 10
what are
years.
They doing? The same.
They're struggling through with not an adequate amount of service, or else they're trying to find money to pay for it out of their other budgets. You know, the long and the short of it is, 10 years ago, community mental health had 80 hours of dedicated service in the Grand Traverse County Jail. Right. At the time that the enabling documents were signed. Now we're lucky if we're getting 8 to 10 hours. But we're still paying the same $682,000.